Health experts nationwide agree we are now entering into the endemic phase of the COVID-19 pandemic. The CDC is saying that for most of the country, things are shifting. Green means low community levels of the virus, yellow is medium, and orange is high. And here in Northeast Ohio, while COVID infection rates are dropping, another virus we all know too well is making people sick. Carmen Blackwell reports.
While the World Health Organization is discussing how and when to officially declare COVID-19 an endemic, flu and influenza cases are back and on the rise.
But there's less masking and more social interaction, so it's not surprising that we'll see flu cases.
Dr. Keith Armitage, an infectious disease specialist at University Hospitals, says the spike in flu cases this season are expected.
I don't expect them to ramp up to the level that we would see in a pre-pandemic winter where we would have a very busy flu season. But if we do see an increase in the next few weeks, it would be typical for life before the pandemic.
Diane Kiggins in Cuyahoga Falls tells us for the past 2 weeks, she's experienced the worst flu symptoms she's ever felt before.
I got up and every muscle in my body just ached really bad, just really bad. Fatigue was completely terrible.
Typically, flu symptoms last up to 4 to 5 days, but for Diane, it's been over 2 weeks.
I know there's different strains of that, but they had said, if you get it, it should be a milder. I don't know how it could have been worse.
Dr. Armitage says Diane likely contracted a dominant strain of the flu that's circulating this season called H3N2, which experts say is troublesome because it tends to mutate faster than other variants of influenza. And while Diane received a COVID vaccine, booster shot, and a flu shot this year, health experts are also saying the flu and influenza vaccines are only 40 to 60% effective. And this year's flu vaccine is not a good match for the flu strain that's going around.
The COVID vaccine was incredibly helpful to blunt the impact of the pandemic. The influenza vaccine honestly is less impactful. It's still very useful.
Now, this new strain of the flu may not lead to as many hospitalizations and deaths as COVID, which is really good news. But even while COVID numbers continue to downtrend, the comeback of the annual flu season could collide with Omicron surge now that mask mandates are being lifted and we're not socially distancing as much anymore, which could possibly lead to what health experts are calling a twindemic. Biggest takeaway, if you're feeling any flu symptoms for more than 4 to 5 days, go see your doctor. Isabel? Yeah, good reminders there. Thank you, Carmen.